Hi, everyone. So excited to be back for another episode of Connecting the Dots. I am still moving into my new office space, so please ignore boxes and things behind me if you're watching on YouTube. I am so excited for today's guest. We have connected in different capacities over the last few years. And I've been really inspired by her journey this year, specifically through pregnancy and birth and postpartum, and have been really wanting to have her on the podcast. But we both wanted it to be the right time, and now is the time. So, cannot wait and would love for you to introduce yourself and share a little bit about who you are and what you do for a living, all that good stuff.
Thank you so much. Thank you for this opportunity to talk about it.
Yeah.
So I'm Darrah Kempka. Almost said Darrah Diaz. And I'm a nurse. I'm an RN, and I own Natural Infusion Partners, which I think is how I met you the first time.
Yep.
I hosted a combo ceremony, like two years ago
Yeah.
or so. But I started my business 3 years ago, in January of 21. And my primary focus at that time was an alternative therapy called ozone therapy. I'm an infusion nurse. I do IV therapy, and ozone, it kind of falls into that category. And my business has kind of just like evolved as I've evolved as a human as well. And I think I started off offering ozone and IVs, and then I started incorporating the ionic foot detox, and then I'm like, ooh, combo's really cool. I want to do combo. Let's do that. Let's host other friends that do really cool things in my space together. And so it's kind of evolved into this wellness hub of all these different modalities and cool things that I'm into right now, and just sharing it with my people and my community. I love bringing people together. I think the IV room is such a great space for that. But yeah, I love hosting events. What else do I do? Oh, I learned about a type of body work this past couple of years. It's called CST, or cranial sacral therapy. And so I've started incorporating that in the mix too. But like you said, this past year, my interests and areas of study and research have definitely shifted into a different area, the whole world of birth, that I had never really gone down the unconventional road before, because I had two kids fairly young, 25, when I had my first kid, and I was straight up in the conventional RN world at that time, kind of fresh from nursing school. And so I had two very conventional medicated induced hospital births the first time, two times around. And not that this child was totally unexpected, but it definitely wasn't in our original path. And so I relearned everything with this pregnancy, and it's been quite an amazing journey. And so I feel like my business, as it always does, has kind of shifted to, again, just like whatever it is that I'm into. And so recently, this past year, I started hosting community circles, prenatal groups. We're about to have our first postpartum meetup.
Oh, nice.
And yeah, my vision for my business has really kind of evolved into more of like a community center to offer all these things that I'm into. So yeah, just a little bit about myself in preview into kind of what we'll be talking about.
Oh, I'm so excited. I have so many follow-up questions for you. Before we get into it, I've been asking every guest this season, what is a daily ritual or habit of yours?
I love that question. I think rituals are such a really cool way to connect to yourself and really, feed into the self-love bucket, which just helps overall. And so I try to keep rituals as best as I can. I'm kind of like the type of person who changes it up a lot, and so right now my rituals look very different than they have before, but I'm really enjoying morning time with baby. We go outside and get in the sun, and we do our little stretches. Sometimes we'll nurse. And then I usually come in and hand them off, and then I get to do my little morning ritual, which has been skincare. Like, I love just freshening up and rubbing on all the oils and just getting ready for the day. really helps set the whole day up, and I usually make my bed and I'll take my tinctures and like a couple different supplements and chug some water, drink some coffee, make some breakfast. And then I'm like, however the rest of the day goes is totally fine. As long as I have that morning little routine going, that's what I do.
I love it. Do you have a favorite product you're loving for your skin?
Thank you for asking.
Yeah.
So one of my friends who was a client of mine, and then she ended up having her home birth and learning about herbalism. She makes her own local herbal products, and she makes tallow products, but all kinds of other stuff. And she just made an ozone oil that I'm completely obsessed with. It's ozone plus herbs, and it's in a spray form. Been loving that for me and for baby.
Yeah.
And I love like she has these really great sprays, these like hydrosol sprays that are just so refreshing and smell good. So it usually incorporates those two things somehow.
Okay, love. Kind of takes me into my next question that I think a lot of people have been asking me about, because a lot of my friends, when they dip their toes into wellness, they're like, oh, I'm sure Kath has heard about this before, is ozone actually. And I am definitely not an expert on it. So I'd love for you to share a little bit about what it is and what are some benefits of ozone.
Okay, great. Ozone is an amazing therapy, and it's actually, technically, it's a molecule. So ozone is oxygen, it's O3. So, normally when we think of oxygen, we're thinking of O2. So ozone is O3, it's just a gas. And so ozone therapy, what we can do with this gas is pretty miraculous, and it's not even completely understood. There's so many benefits to this therapy because it really addresses a lot of different root cause avenues, right? So it's an anti-inflammatory therapy. It works on the same pathways as like biological pathways as like a steroid would. So it's very anti-inflammatory. It kills pathogens. They use ozone gas to purify swimming pools in the air and kill germs off of surfaces and stuff. And so when we use it therapeutically, it can be very beneficial for any detox protocol. It'll kill viruses and bacterias and molds and parasites, limes, all that good. So a lot of people love it for that reason. It really works well with the body to kind of stimulate or like probe the natural and innate immune responses in the body. So it'll kind of give the body this nudge in order to then respond with a very healing immune response. And so similarly to how like cold plunge works or microneedling, this is a hormetic therapy. It's a stress therapy. Ozone creates oxidative stress in the body, and then the response to the stress is the healing piece. So it's an antioxidative therapy. It's kind of very confusing if you try to think about it too hard, but just kind of throwing out some keywords to kind of help you understand what this therapy could be helpful for, because the list is really long. But pretty much like anytime you're sick with any sort of like acute viral illness, a bacterial infection, if you're trying to avoid antibiotics or steroid use, it's really helpful. We get a lot of kids in with ear infections and maybe allergies because we can put it in the ears and the nose. And there's also a lung treatment that's really great. If we bubble it through oil, then you can get the ozone into your lungs, and it's really helpful for coughs and congestion and bronchitis and infections there in the lung tissue. So ozone is a gas, but the therapeutic benefits are very vast. And I love that it's an option for people who are needing to really get relief in symptoms, but don't want to use drug therapy. Yeah, so that was a little spiel on ozone.
Yeah, the first time that I was ever introduced to it was before I met you. I wanted my fiance Luke to get it because he has really bad allergies in Texas. And so he got it. I think it was in his ear.
Okay.
And he was like, what am I doing? What am I putting in my body? I have no idea. I heard it's good. So just do it. And you can also do ozone in other places, right? Like vaginally or rectally.
100%.
Yeah.
It's a gas, so it's very versatile. You can take the gas, and what we do is we fill it into a syringe. There's these generators, which, by the way, anyone can purchase an ozone generator. It's a great tool for your home. It's just this kind of really simple piece of equipment that you take. You can get oxygen. That's probably the hardest part, is getting the oxygen, but it's not impossible. You can get it from any local welding supply store. You hook it up to the generator. There's a little output port that you screw a syringe to, and it fills up the syringe.
Okay.
And then you can put that gas in your ears, in your nose. You can use it vaginally and rectally. And all of these are examples of localized treatments. They're called insufflations. It just is a fancy word for putting gas into a body cavity. And so if you were having an infection in the vaginal canal, then you would want to get the gas as close to that as you can. So I would recommend vaginal insufflation. If you're having hemorrhoids, I would say put the gas rectally to get it closest to the hemorrhoid, that kind of thing. And also the rectal insufflation, a lot like enemas and other coffee enemas and different things you can put rectally, these do have more of a systemic benefit as well. So if someone has a chronic illness, then doing rectal insufflation of ozone, something that's going to be very anti-inflammatory, and it really vitalizes tissues, helps tissue repair, kills cancer, all that kind of thing. Like you can do this rectal insufflation at home 2 to 3 times a week if that's something you can tolerate, and it's really helpful for chronic illness as well.
Oh, amazing. I didn't realize all of that. I knew that people did it for hemorrhoids. I've seen you post about that and all of the wonderful benefits, but that's
Yeah,
so amazing.
it really truly is an amazing therapy, and it's been around for a really long time. I think people are like, what's this crazy new thing? And it's been around for, I think Dr. Schallenberger, who's the first kind of outward spoken MD that uses ozone in America, has had his practice for 35 plus years, just kind of underground. But yeah, it's been around Germany, and especially since COVID, you'll find a lot more studies on it overseas.
Cool.
Yeah.
Amazing. And correct me if I'm wrong, but you help train people in ozone?
I have done that. Yeah, that's another little thing that I that I've kind of evolved my business into. So I'm an RN, and when I started sharing about what I do in the clinic setting on Instagram, it was like I got all these nurses reaching out saying, "How do I want to get out of the hospital setting. I want to get into holistic. Like, what is this therapy? How do I do it?" And there really wasn't a great place to learn as a nurse
Yeah.
how to really manage these patients, right? It's like there's a lot of really great training out there for practitioners or businesses who, and it's all the training pretty much is offered from the companies that sell the equipment. And so like their training was more around like, what is ozone? How's this going to help your business? Basically convincing doctors to take ozone on into their practice. But there wasn't a lot of really good training for the nurses, like the actual clinical usage of it. Like, what dose do I use? How do I know when to use it? Like that kind of thing.
Yeah.
Recommended or talk about it. So I created a nurse training program, and I did it for 3 years in a row. And then this year I couldn't do it because I had a baby, and hopefully I'll be able to do it at the end of the year. But it was just a way for me to kind of answer to the requests I was getting from the community. And it's been really, really cool. And I've done a couple other little trainings like for people how to use ozone at home as well.
Yeah. Oh, I love that. So yeah, I always want to plug like any way that listeners could work with you. And so wanted to make sure we covered that. And you kind of touched on this of, not nurses looking for information, how to do this, going into the wellness or holistic world. How did you make that transition?
So, like a lot of people out here in this world, you kind of you go and lean towards these things once you've tried everything else and everything else has failed you, and then you're like, okay, what is it that they're doing out there in the woods? And so it was kind of like that for me, but it was more about my son. I also have they're about to be 10 and 7. And so when my younger son, my 7-year-old, was like 3 months old, he had really bad eczema. And so it was like bleeding and cracking, and I just couldn't. And nothing was working. Of course, the creams, they wanted to like start him on an oral steroid. And there was just something intuitively inside of me knew like there has to be a reason why this is happening to him, because it didn't happen to my first son. And I had like switched pediatricians all around, and someone finally reached out to me and was like, hey, have you ever like tried removing dairy from your diet or like done a gut healing protocol? And this was 7 years ago, which I'm sure it was like, it's definitely not as known about, it wasn't as known as about then as it is now, but I feel like I went through this like, oh my God, this whole world of healing and options for moms, especially, that you can do with your children and for yourself through food even, and just like really basic nutrition. Yeah, I feel like I went through this whole like shift. I went through rabbit holes, listened to a ton of podcasts, and I was working at the time at an infusion clinic in neurology in Dallas. And right across the street from my office was a really big, busy functional medicine practice. And so one day I just like was so fed up at work. I started kind of getting into this functional medicine world with my own son. And then I would talk to my like MS patients about, have you heard of Terry Walls and what does your diet look like? And all of this like anti-inflammatory, and all the neurologists thought I was crazy. Like they called me kale girl. And I just like got so sick of it. And so I walked across the street one day for lunch and I was like, hey, I don't have any experience in functional medicine, like except for my own knowledge, but I can do IVs. And they had just brought in a doctor from Louisiana who had brought his ozone generator, and they were looking for someone who could run their infusion suite. And it was just, I swear, it was like a God thing, it was like just perfect timing. I mentored and trained under him. And then he brought me to some of the other trainings, but it was really the experience that I had at that clinic, because it was such a very busy clinic. And the other main doctor there was kind of world renowned for mold toxicity. So I got to see a lot of really sick patients, a very busy clinic with mold, Lyme, cancers, all these things, work with ozone. And it was amazing. I mean, miraculous stories and things that I learned from my clients, working with them and figuring out protocols with this doctor. And it was truly amazing. And then COVID happened, and we got to see how ozone worked with that. And that was another amazing thing that I got to see and work through and witness. And so that's kind of how I got to where I'm at now.
Wow, that's so cool and so great that you got to have so much hands-on experience with the ozone. Because I was going to ask, since if there were not a lot of protocols available readily for nurses, how did you learn them? And so that's so amazing.
Yeah, it was a lot of trial and error. I will say that's the thing about ozone is it is a really safe protocol. There's not, it's a naturally occurring molecule. Our bodies produce ozone naturally inside of us. That's like, no one's allergic to ozone. It'd be like being allergic to oxygen or water. But there are some things definitely that you want to consider. One of the most important things you want to consider is the patient or your personal toxic load, because you can have some pretty intense detox reactions. And so this is the part where we kind of really worked with, and the nice part about where I was at is I was surrounded by all these doctors who had a lot of experience in detox already. So they knew how important it is that we address the gut first, and that we're using binders and drainage pathways, and how's your liver and gallbladder. And so there's that holistic approach to it, which I do offer in my nurse training event, because I think that part is so important. And it would be nice for nurses not to have to like experiment on people before they figure out the right dose. But it was a little bit of that, and then a little bit of also personally using it, using it at home with my kids. And that's how I got to experience it, and then share it with what I learned myself.
Amazing. And then what made you want to then add cranial sacral therapy to your repertoire?
Yeah, so just like adding ionic foot detoxes or adding IV vitamins and minerals and kind of all these other things now that I incorporate, it really was around supporting the ozone client. So like, how can we maximize the potential of this therapy? And we know that, so opening drainage pathways is important. remineralizing first is really important. Adding in some vitamin C to kind of increase that antioxidant response can be very helpful. Along with that, I learned along the way how important it is for your nervous system to be in a specific, state in order to really heal. And the more I learn and get into this work, and especially like with myself, the more I can understand how really fundamental actually nervous system regulation or nervous system work, addressing what is causing your nervous system to go awry and not be able to come back right to kind of this centered state. Maybe there's some chaos and interference there in the nervous system. Really, that is so foundational to healing in general. But in the context of my business, I think definitely doing that work and then doing something like ozone therapy, we see the best benefits and the best results. So that's kind of where it came from.
Yeah.
Also, I love receiving CST, and my children and my husband really need CST. And so I was like, I'm going to learn this therapy so I can do it for my family.
Yeah.
And then we'll see how it bleeds into work. And then I took an infant and newborn course, or not course, but like training, training so that I could do it with my newborn too. So yeah, it's kind of that came about.
I love that. And I'm glad it's somehow this season, I didn't plan it this way, but nervous system regulation and loving on your adrenals has just been such a woven theme throughout almost every interview that I've done. So I'm very grateful that it's continuously being reinforced how important it is to feel safe in your body and, like you said, kind of be able to come back to center when the world is throwing whatever it's going to throw at you your way. And I love that you were able to bring it into your family and learn how to use that therapy on a newborn. So exciting. Which kind of brings us to the juice of how you decided that you wanted this pregnancy experience to be different from your last two.
Oh man, it's been a crazy year, honestly, of like it just one decision and choice kind of led to the next and to the next. And, I think going into the pregnancy, I really didn't think much about it. Like I was like, oh, I'll cross that bridge when we get there. But I did know upfront that I didn't want to get an epidural this time around. I mean, it's like now knowing what I know, you can't unknow these things. And I was like, yeah, I don't want to do the epidural, not only because, we know that there are effects to baby, but also like I was injured in my second birth. They had to do the epidural 3 times, and I ended up like it was icky, and I had was shaking during my pushing. I didn't know how to push. I still felt everything. I still have back pain like where the epidural was. And so that was kind of my story for my second birth. And because of that, I just knew that I didn't want to do the epidural. And I knew if I was in a hospital that I would inevitably probably choose the epidural because it's available there and what all the things that lead to that. So I was like, okay, I'm going to do a home birth. So that was my first kind of choice.
Yeah.
And then it evolved into, okay, now I need to find a midwife, right? That's kind of like the next step whenever you think about home birth, or at least it was for me.
Yeah.
And so I started asking around to my community, like, hey, who's great? What questions should I ask?
Yeah.
What are some things to think about? Like what was your experience?
Yeah.
And I've started hearing all of these little tiny, my birth was great, but, and one of the things that someone told me really early on was like, hey, did you know that if you go past 42 weeks or you're even before 37 weeks, you won't be allowed to birth at home, and kind of all these little things that I didn't ever know that midwives are really held to because of their license and state regulations. And I started hearing all these stories about births being sabotaged because of their midwife. And I still didn't know about free birth, and I still wasn't gonna go that route
Yeah.
because I just didn't even know that that was a thing people did.
Yeah.
I just kind of went into some midwife interviews with all these questions like,
Yeah.
well, what do you mean? Like, what do you mean you're just gonna fire me as your patient? Like, isn't it my choice to go to the hospital? Like, what if I just say no? Like that kind of thing. I'm
Yeah.
a very like curious person. And anyways, I did all these midwives, and don't get me wrong, there's a lot of really great midwives in Dallas, but none of them passed my like questions, and at the end of the day, if you do choose to work with a midwife, like a medical midwife,
Yeah.
a licensed midwife, like you will have certain things that you have to do in order to work with these women. And so anyways, someone introduced me to this podcast. It's called Free Birth Society. And I just nosedived into it. And I learned that you don't actually have to have anyone there. Like you can do this by yourself. And at first, it seemed like the most radical, like
Yeah.
badass thing that I would never be able to do. Right. It was like, wait, what? And I had seen on Instagram like someone's birth video, and I was like, when is the midwife coming? Like, and she never came.
Yeah.
And it brought me to tears. And I was like, wow. So I remember talking to my chiropractor that I see, which I think you interviewed him, Dr. Chris.
Yeah.
Yeah, he's so great. But I've been seeing him for years. And if I'm gonna get advice from someone or like at least a consult, like, hey, what do you think about this?
Yeah.
It's usually from him because we just have such a great rapport and I really trust like his intuition. But I was like, yeah, there's this idea that I have, like I could free birth, but like my husband would never let me do that. And he was like, that's interesting. How he does, like, right? Like, where do you think that's coming from? And so this entire pregnancy was a series of lessons and opportunities for me to really look at all of the fears and all of the choices and really grow through that, right? It's like, no, I think a lot of women, could blame their husband for a lot of things, but in in this world, like in the world of birth, right? It's like if you really want to have a free birth or a home birth, you will make it happen,
Right.
And I was totally being, what's the word? Like I needed Andy to be okay with it for
Mm.
me to be okay with it,
Yeah.
codependent, right? And like I didn't even know that I was doing that, but I was able to heal that part of our relationship through free birth and through wild pregnancy. And I think if if I was grateful for anything, other than having an amazing birth and a baby, it would be that like this opportunity to heal a lot of things in our relationship and a lot of things about myself, taking responsibility for every choice that I make, and really, really owning my power and ability to do this thing that all women can do and all women have access to do. You just have to choose it, and you have to, every fear that comes up, using that as an opportunity to really look at yourself and figure out like, what experience do I want to have? And let's create that. And that's what having a wild pregnancy and a free birth is about.
So inspiring. I was journaling before our call and I was thinking about the conversation and what I wanted to talk about. And it just kept coming up for me, like how empowering it all must have felt for you. And I love how you said when you first heard about it, you were like, what a badass thing. Like that just kept coming up for me. I was like, I just want to talk to her so much about like how empowered and I'm trying to find like the right word to describe it, but like confident in yourself and your intuition and your ability to make decisions you must feel after doing something that it does feel radical. It does feel so against the grain, and that people do have so much fear around. And I'm sure since you've shared on your Instagram, people have had so many questions, but what about this? But what about that? But what about here? So yeah, I would just love to, if you are comfortable with just like a reflection of how you feel after making these choices for you.
Yeah. So I love that you use the word confidence. Like a lot of people have been using that word, like you have so much confidence, or you have, you know, to me, what it has been is really like building that faith, right, to me. And it's really been a very spiritual journey for me. And I didn't grow up religious at all. And so I think my health and wellness journey has also been that of a spiritual journey, right? It's all connected. But what this was for me was definitely a more of a spiritual like thing for sure. And confidence is just to me another word of faith, right? It's like I have faith that in my body and in my baby and in my birth. That
Yeah.
was one of my affirmations. It was like,
Uh,
I trust my body. And trust is another huge lesson in this too. And like, if you struggle with having trust in your body to heal or trust in your body to do anything, and you are want to be really committed to figuring out how you can trust that, have a free birth, because that is what it is about. Like it is full on surrender and trust and faith that whatever is supposed to happen is going to happen.
yeah.
And, what's really cool is one of the exercises that they do in Free Birth Society is to really, when you're pregnant, sit down and visualize your dream birth. Like it could make no sense. It could just be like, what does it smell like? What does it sound like? What is the setting? That kind of thing. And every time I would do that, I would imagine myself laid in the middle of the night, like going through labor all by myself, and then being in my bathtub. And then as soon as everybody woke up in the morning, the baby would be there. And it was like, that is literally what happened in my birth.
Yeah.
Um, and it just to me really proved that, yeah, that I can follow my intuition, that I can trust my body, and that I can have faith in God, that He's going to show me the way.
Wow. I literally got chills. I was like, oh my gosh, like I love that you were able to have that experience and feel that trust with higher power within yourself, within your body, within your baby, within your experience. And you are the second person I've talked to as recently talking about visualizing exactly how you want something to go and
Mhm.
that be how it happened. So definitely want to chat a little about that because I did watch all 4 parts of your story and love them, but wanted to know as you were, because I know that you had said when I first heard about free birth, I was like, couldn't be me. Like,
Right.
how could I do this? So I know that the conversation with Dr. Chris made you start thinking, well, okay, maybe I can talk to my husband about this. Maybe that's not a good excuse, but what got you over the hump to be like, this is what I'm doing?
Yeah. So I would say really it was listening to the podcast, and the podcast is all birth stories.
Cool.
And there are probably, I don't know, probably hundreds of episodes on this podcast of women telling their free birth story. And,
Cool.
I think I'll back up and say, like, I didn't decide it was going to be a free birth probably until like probably halfway through. I still was like, well, I still want a woman to be there. I think it was more about looking back. I wasn't sure, like, I kind of felt like I would be able to handle it, but that I needed someone there to keep the whole energy of the vibe of the space
Mhm.
grounded, because I was like, look, I'm going to be in birth world, and I can't have like my husband and my children and whoever else there like be interfering with me. So I need another person there to like do all that.
Yeah.
So I still was like looking for a doula or a midwife or someone to really like hold that down,
Yeah.
because I wasn't sure that I would. Anyway, so all that to say, it took a long time for me to get to the place of like, I'm having a free birth, I'm doing this alone
Yeah.
without a hired professional.
Yeah.
It's just going to be us. But yeah, so it was an evolution, but what helped the most was hearing other women's stories about it. And then I had such this like craving and desire to talk about it with people, and I didn't want to talk about it with just anyone because it was such a radical decision and idea, and a lot of women, especially like my age, right? It's like women who have already had births, and so they have their stories or their stories that they heard from their friends. And these stories that we carry and that we hear really seep into our beliefs and our fears. And so I was just like, I don't have anyone to talk to this about, it's like, and I have to talk about it in order to really feel like this is something that I can do, that I have enough trust in this. I need to talk about it with someone. And I started like asking around, like I think I joined the Free Birth Society like online group, and that was helpful, but it still wasn't anyone near me. And I don't know, maybe there is a Dallas, Texas free birth group and I just couldn't find them. Like I didn't know, I still don't know many people in this local area that have done it. And so anyways, I started this prenatal village concept that I borrowed from, or that I took from Free Birth Society. They teach you how to hold these prenatal groups.
Cool.
And I was like, screw it. Even if people like whatever, wherever you're at, I know women need to talk about their pregnancy and their birth plans and all of this. It's like such a part of it. Like I'm just going to start this and hopefully it will help me in some way instead of like drain me more. But I ended up finding Amanda Tellhurst is an RN who she does body work. I've known her for a while. She does CFT on newborns, but she's actually in a midwife program now to be like unlicensed midwife. So not like a licensed midwife, but so anyways, and she does offer doula services. So at some point in this journey, like I decided, hey, you're the closest person I can find. I couldn't even find a doula who would come to a free birth. So I was having a hard time with that. So I chose Amanda. I was like, okay, you're one person I can talk to about this. And then we started Village Prenatal, and that group of local women who came together helped me so much, make like just being heard and being validated, and like all my fears, any fear that would come up, I would bring it to the group and I would talk it out, and they just were so supportive. And that is really, I think, what gave me the strength in order to be like, okay, I got this. I can trust my intuition because other women are telling me that I can. That was such a big piece of it.
I love that. Oh, and I loved watching the stories that you posted. It felt, I know that you said at the beginning of this, you love rituals. Like it felt so meaningful and intentional and like such a beautiful ritual. And I know you brought elements of that into the space, and there may be a want to be pregnant.
Oh, I love that.
Awesome.
Yeah.
I know that listeners are going to be like, okay, I totally get it. You've had this experience, you're empowered, you trusted. How did you know what to do? Does the Free Society like teach you?
Yeah.
Is my head first, I saw some of your stories, like, how do you know how to birth the placenta? How do you know how to cut the
Yeah.
like
So valid. So valid.
Yeah.
And I'm that way too. Like, of course, I'm a nurse. Like, I am a Virgo. Like, I need to know
Yeah.
all the things. And I think some women doing that is important, but I don't think it's necessary. I don't think you need to do that. I think everything about birth is so primal and so instinctual. Like, really, if you're going to really have to choose one thing to practice while you're pregnant for a free birth, is to truly surrender to the process. So like I would do cold plunges when I was pregnant, like that kind of thing, like truly surrender to the body doing it for you, but also that intuition, right? It's like, oh, something's off. What is it and what do I need? And part of knowing what you need and what's off is doing the the research, right? And the learning. But you definitely don't have to be a nurse or a medical person to do it. It's all very, very, very instinctual. And first-time mothers, there's so many first-time mothers who have free birthed. You know, I think it's a little bit more common for women who have birthed before to feel like they can do this, but it's not impossible. Like there's tons of women who choose free birth for their first baby. But I think that did help me. Like I knew that my body did a good job at birthing baby. So I kind of knew from my previous births, but I did take a course, and Free Birth Society has an amazing free birth course. It's all like online modules and like self-paced, and I mean, it's very comprehensive. They go over every single complication that could happen, what to do. They really do a good job of that. So grateful for that.
Oh, that's so amazing. And you had said that your birth, the exact way that you wanted it to happen, did come to fruition. And so, what were your main takeaways of your birth experience?
Oh man. Okay. So I think I had my due date wrong. I think that's kind of an interesting thing we could talk about.
Yeah.
I was doing it based on this app that I had. I had been tracking my periods pretty consistently.
Yeah.
And so it had calculated my due date for me and, you know, all these things. But it's kind of interesting now looking back. Like I think intuitively all along, I knew I was farther along than what my app was telling me. Like I would always skip the weeks and what to expect or whatever.
Yeah.
And I was like, I was bigger than I thought I should be, like all the signs.
Yeah.
But had I had I had a midwife
Yeah.
and given them gone off the original date, I went into birth at 36 weeks and 4 days. So
Okay.
technically preterm birth, but I didn't even think the words preterm birth didn't even enter into my mind during the birthing process at all. Like I just knew like this is time and we're good. Like I'm ready. And even like everybody who saw me the days prior to were like, you're giving birth soon. Like it's not, you don't have another month, like you're going to be giving birth soon. That was a really cool lesson because but I will say, I didn't think about it being preterm, but I will say I was in denial about it. I think until my body started pushing the baby out, I was like, it could be days, it could be weeks. Like, but yeah, it was pretty fast. Like, I think around like 11:30 p.m. is when my water started to leak. And I lost my mucus plug earlier that day. And yeah, it just like it all happened pretty textbook. You know, it's like one of the things they say in free birth is every birth is the same. Like every body does the same thing. It's like a hormonal shift or like sequence that everybody does the same thing, but every birth is different. So it was like exactly that. It was like, okay, my water started leaking, my contractions got like, you know, they're actually never really painful. That was one thing that one of the reasons why, if I had some fears going into it, that was one of them. I think I worked through it pretty good because I got this book. It's amazing. Portal, choosing orgasmic, pain-free, blissful birth. And so there's a lot to say about that, but basically not very painful, but I could tell that the contractions were getting like more intense as they went along. And what are my takeaways from my birth? Okay. So definitely a takeaway was that my husband did so great. I was mostly worried about that. Like I was like, oh, is he going to say something that's going to completely throw me off? Or is he going to do something that's going to piss me off and take me out of my primal instincts? You know, how is that going to go? And he was so good. Like, I don't think I told him. I knew he had a lot of fears about home birth in general, so I tried to like feed him information about what I was doing, like in bite-sized bites, like he
Yeah,
knew he was might gonna have to catch the baby.
yeah,
I had planned for Amanda to come to the birth, but in the moment, like I didn't even wake Andy up, like I just let him wake up on his own because I wanted it to just be me and the baby. Like I didn't, nothing inside of me told me to call her or to worry about anything. But yeah, I think one of the takeaways was like, I'm so impressed by Andy, and I did not give him enough credit
yeah,
for his ability to know exactly what to do in the moment, like
special.
because I had him a month early, I did plan on sitting down with him and Amanda and being like, here are all the things not to say to me. Here's like, if this happens, then this. If this happens, then this. And we didn't have time to do that. But he just knew intuitively, what I needed. And so that was really cool.
That's so special.
Yeah.
And you had said that you had affirmations going. What else did you do to make your space for you during the birth?
Yeah, so I spent a lot of time in my bathtub before when I was like pregnant. So like I think I was practicing a lot, like just being in that space, and I did a lot of prayer in my bath. And so it really felt like my little sanctuary, it was like there wasn't a lot of things that he did. I lit candles. I had some things there that were kind of sentimental. Like I had our village prenatal group made a candle. Everybody got a candle to light for when they're in birth. And I had the affirmation cards were really helpful. I had red light. I love my red light. That was like the best. I highly recommend using red light when you're in birth and in postpartum.
Yeah.
Yeah, I don't know if you know Kayla Strong. She is a really great friend, but she is also I call her my therapist. She does NLP therapy.
Oh, cool.
And so I had just gone to a group session with her, and we had um, basically built this like internal altar that you can go to. And so I used that in my birth.
Yeah.
I like went there. I will say too, like another takeaway is that you have access to, in the book they call it a portal, right? It's like
Yeah.
you have access to this amazing like psychedelic experience.
Yeah.
Um because birth is a portal, it's like you're going from one version of yourself to the next.
Yeah.
There's no escaping it, really.
Yeah.
And if you choose to really be there and present for that and really, dive in, if you will, yeah, I felt so good. Like, oh my God, I just can't, especially compared to my other births, like after the birth, it was like I was like high, like I just was in this postpartum bliss, and it lasted for days. Like, oh my gosh, I wish it had lasted longer, but I did not feel remotely close to how I felt with my other two births. Like, I remember my other two births being a little psychedelic. I was also on drugs because I had that epidural, but
Yeah.
this time it was like, yeah, like I just dove in and chose that, and it was amazing. Yeah.
Incredible. I am just so inspired by you. And I know that you carried some of that into postpartum. And I know we're kind of coming close to the end of our time, which is crazy. But what are some of your main tips, your 2 months postpartum, that you
Mm,
have felt like have kept you grounded and feeling as good as you can?
yeah, this is so important. I actually think that, had I not been prompted to do this, which was prepare and think about my postpartum and how I wanted it to go, there's someone in our village prenatal group, Sabrina, actually, she's a postpartum doula. She was like really encouraged us to think about this and do this. And I had kind of heard about it on Instagram, but there's this 5-5-5 rule. And I think if anyone asked me for any advice during the pregnancy or birth or whatever, I would say, do the postpartum 5-5-5. Like it's so great. And what that is 5 days of truly not getting out of bed. So it's 5 days in bed, 5 days on bed, 5 days near bed. So basically 2 weeks of like being in bed. And I didn't leave my room, but once when we got him circumcised, which is a whole nother subject. But on day 8, I left to do that. Other than that, I did not get out of my bed for 2 weeks. And that means like people are serving you every single meal. They're giving you water. They baby and we were naked the whole time. I did free bleeding, which, one of the things with free birth is if you tear, like you don't have access to stitches.
Yeah.
Which is actually better for faster healing if you tear. So, and the best way to do that is to like free bleed and let the area like have air circulation and those things. And so, yeah, you're naked and you're bleeding and you're in bed with your baby sleeping. And so because of that, like it was so easy to not have a ton of guests. Like, I'm like, well, maybe in a couple of weeks when I'm not naked and bleeding, you can come over. But I think not having a ton of visitors and just being in bed, skin to skin, I mean, aside from like being able to stay kind of in that like psychedelic bliss state, there was so many benefits. Like breastfeeding was so easy. My milk supply is like perfect. It's not too much, not too little. My pelvic floor, I think I did tear a little bit and it healed up super fast, probably like in 2 days, I would say.
Wow.
Yeah. And then bleeding, like I remember with my last 2 pregnancies at my 6-week appointment, I was still bleeding and I was done bleeding by the 2 weeks was up. And that was really great. And I just had my first workout this past weekend. And I think, I'm glad I waited because it was tough. It was really rough, but like my pelvic floor felt really great. I didn't feel anything there. Like it felt strong, and I had a little bit of like DRA where your like abdomen separates, but that is like already so much better. So I really think that do not get out of bed, be naked and just enjoy those postpartum that we have access to being in a blissful state in our postpartum. That is not the case for everyone. It's more the case with free birth because of the hormonal cascade that happens when birth is truly uninterrupted and you're able to, a free birth is defined as birthing without a hired professional. But there's also, sovereign birth, which is when you have like a doula or not a midwife, licensed midwife there. Basically, you have the power over all your decisions. But then there's something called physiological birth. And this is where physiological birth is when you have birth in a dark, quiet space, truly uninterrupted. And when you can do that, and you allow the process to happen as it's designed to, then according to the hormonal cascade, you should be feeling blissful in your postpartum, or you can be feeling like that. And that is such a gift. Like, oh my God, I want to have another baby just so I can have a postpartum vacation, for real.
That is, I feel like the opposite of what you hear from most people. So how beautiful and how affirming is that? I love it so much.
Yeah, it was really great. I highly recommend that.
Well, thank you so much for sharing all of this with me, from your journey into the wellness world to your journey over the last year with your pregnancy and your birth and beginning, mid stage of postpartum. I'm just so grateful that you allowed me to use my platform to kind of share your story and learn more, because I've been, like I said, I've been so eager to chat with you about it all for when the time comes for me to have a
Yeah,
child.
girl.
Yeah, I've definitely always been alternative route, but I had never heard of this until you. So selfishly, I've been like really excited to learn more, and just always so grateful that you are so open with what you're going through, and that you do truly bring the community into what interests you, because it's just so important.
Yeah. Awesome. Well, when you're ready, I'm here for you.
Yep. Well, talk to me end of next year and I will probably be there.
All right.
Would
Awesome.
love to wrap up with one piece of advice that you would give your younger self.
Mm. Yeah, I think, that Bob Marley song keeps playing when you ask me that, like, don't worry, stop worrying.
Yeah.
I think dive in with open curiosity and don't worry so much.
And how can people reach out to you to work with you, to come to Natural Infusion Partners, to
Mm.
see? I know that you have other people who are in your space sometimes offering things. So
Mhm.
plug your business. Tell us what's happening.
Oh, thank you. Yeah, we actually moved my office from Dallas to Grapevine, which is where I live. And I have this super cute little house. We're still trying to figure out what we're going to call it. Something like Mama's house or the healing house or something like that. It's this really cute little place. And yeah, I kind of started renting out this space, especially right now while I'm on maternity leave. I have a holistic esthetician who's there right now. She's got a really great earthy facial. She's very massage forward. She's also certified in CST and lymphatic drainage. So she's amazing. You can book with her. Her name's Tay Leahy. And then I have actually another. He's an EMT who has his own mobile ozone business, but he's actually seeing clients out of my space right now. So you can still get ozone and IV services at Natural Infusion Partners with Alex on 1 day a week. And then I'm hosting the circles again starting this week. I'm going to be opening a new prenatal circle soon. And these are, just for funsies for me, but that is a way that you can come in as well. And we'll see. I don't know what it looks like yet this year. I would like to be able to stay with baby and really continue to breastfeed him. And so I don't know what it looks like yet for me to come back to work, but I love that about my business is like, well, who knows? Just come and hang out. And I'm sure you'll find a reason to come back. It's a really special place.
100%. And
Yeah, it's Natural Infusion Partners. You can find me on Instagram, or my other handle is Darrah Kempka RN _RN to kind of see what I'm up to. I'm a manifesting generator. So like I am just on to the next things all the time. So you can mostly find what I'm into on that account. And Natural Infusion Partners is my business account where you can like book your services and stuff.
okay. Well, thank you so much again for taking the time. I so appreciate it, and definitely can't wait to see what's next.
Yeah.